We want to welcome everyone this morning to Super Adult Sunday School. We'll be doing a presentation on health and healthy living. We're glad that you were able to join us. Today's presentation is topics that touches us all, which is good health. As we gather, it's important to remember that caring for our health is not just a physical responsibility, but it's also a spiritual one. Our bodies are gifts, and maintaining them allows us to continue serving, loving, and living fully. Today's session will explore practicing our physical health through nutrition and activity. Our goal is to encourage, inform, and uplift one another as we learn simple, meaningful ways to live healthier lives. Thank you for being here with us today, and we'll begin our journey towards health. So I was going to open up also with a couple of scriptures. So the first scripture is Proverbs 17:22. A cheerful heart is good medicine, but a broken spirit saps a person's strength. Then Proverbs 4:20 through 22. Keep my words within your heart, for they are life to those who find them, and health to one's whole body.
Now, a word of prayer. Most gracious Heavenly Father, we just say thank you for this another opportunity to give you praise. One, to learn about ourselves, learn about one another, and most of all, learn about you. We thank you for your presence. We thank you for everyone that is assembled here today. We ask you, Lord, a special blessing over all those that are both here and those that had to go on to something else. We just say thank you. We give you praise. We give you honor. It's in Christ Jesus' name we pray and we give thanks. We're going to turn it over to the health ministry team, and we're going to go ahead and get started. Amen? Amen.
Good morning, everyone. My name is Cynthia Johnson. I'm the vice chair for the health ministry. And so if I'm not talking loud enough, please let me know, because I am a soft speaker. I'm not?
Yeah, you just got to have it straight in front of you.
Well, I thought I had it that way. All right. Well, thank you. And I'm often reminded of that, you all, of how I do not project until I'm told to do so. So I will definitely make sure that I project going forward. So thank you very much for being here. So to my right, I'm going to briefly introduce our wonderful speakers today. And I think for those of you that were here last month, or our last fifth Sunday, it was phenomenal. And our goal this year is to do the same. So we will be presenting at least 4 times in the year. Not to say that we won't be doing other things, but we want to make sure that the subject matter always gets out to everyone. Our biggest thing that we talked about last time in November was in regards to kidney disease and good health. We still feel like we have to have a lot of emphasis in that area because there's a lot of myths still out there. However, these 2 experts will go over quite a bit of the information that I think that you all will find helpful, and what we're wanting to do is build on each one of those programs that you have. So first, to my right, I'd like to introduce Miss Jennifer. Jennifer graduated in 2010 with her RN and finished her bachelor's degree. She received her master's degree at Walton University in 2020. She holds many certifications, including trauma certification, and holds, let's get my papers here, and holds a certification in wound care and became a certified wound care nurse practitioner. She is now working very hard and has been doing this for over 13 years. Our second speaker will be Miss Yolanda Thompson. And she is also certified in adult dealing more with kidneys She completed her master's degree, or doctoral degree in studies at the University of Kansas, where her research focused on improving timely referrals to nephrologists to slow down the chronic kidney disease progression and reduce healthcare costs. She's a published author and a clinical trial sub-investigator. She serves as the National Kidney Foundation's Medical Advisory Board, the Renal Roundtable Committee, and as a fellow with the National Kidney Foundation. Without any further ado, our speakers, I will start with Jennifer.
Good morning. So we have a triple presentation for you today. The first one is going to be about nutrition and just overall nutrition about carbohydrates, protein, and fats, and good and bad stuff. The second one's about kidneys and kidney disease and also healthy things for your kidneys. And then the last one is about sleep health and positive ways to sleep healthier and get longer sleep if you're not getting good sleep. I'm not going to take any questions, or we're not going to take any questions in between the presentation. So we'll finish it all out, and then we'll take questions at the end. So thank you guys so much for coming, for putting time into your own health, and I hope you enjoy it. So the first one's about nutrition. Oh, yeah. So carbohydrates are our main energy source. They're broken down into glucose, which is the preferred energy source for our cells. You have your simple carbs, which are your sugars. Those are the ones that raise your blood sugars quick. They're found in fruits, veggies, milk, and in processed food. And as we all know, the processed stuff is not the healthy stuff for us. The complex carbs are your starches. Those are the ones that take longer to digest. They allow gradual, stable rise in your blood sugars. Those are usually the more healthier ones for us, although we know that fruits and veggies are healthy for us. Fiber is also a carb. They're a complex carb. They regulate your blood sugar, they support your bowel health, and they improve your cholesterol levels. Two different types of fiber: the fiber that you find in food, which like your bread, like your cereals, the skins of things, stalks and seeds. And then your soluble fibers are the ones that you buy over the counter, that you put in like a water or a drink to mix and help you get more increased fiber in your diet. Proteins are important for our muscles, our tissues, the enzymes in our body, and our hormones. Our body cannot produce essential protein or amino acids, so we have to get it from some type of food source. Excess protein can be stored as fat when our body already has enough calories. Kidneys are a major part of protein digestion, and we'll talk about that later in kidney health. Your animal sources of your protein include your poultry, your fish, your seafood, eggs, dairy, and meat. Those are your complete proteins with all your amino acids. Your plant sources are your legumes, your lentils, nuts, seeds, and your whole grains. And then you have your supplements, again, like that you can buy over the counter, like the collagen, the protein-based powders, protein drinks, things like that, your gelatins, caseins, and your wheat and your soy. So those are the different proteins. Fats obviously help us provide energy, but they also increase fullness in our body. They help make certain hormones in our body, and they provide a structural role in protecting our cells and our organs. So fat is necessary, but it needs to be healthy fat. So it doesn't automatically turn into body fat. You have your monounsaturated fats. Those are primarily found in your plant sources. Some are found in certain fishes. They help control your cholesterol and your blood sugar levels. The good sources include avocado oil or avocados, olive oil, nuts, certain seeds like sunflower, pumpkin, and sesame seeds, your mackerel, and salmon. Polyunsaturated fats, there's two different kinds. Those are essential fats that are crucial for our cell structure, our heart health, and they reduce inflammation in our bodies. Omega-3 fats are your oily fish, like your herring, your mackerel, your salmon, sardines, and trout. Also, they're found in mussels and flax, soybeans, your leafy green vegetables, chia seeds, and walnuts. Your omega-6 fats are found in corn, eggs, seeds, wheat germ, legumes, soy, safflower oil, and sunflower oil. Your saturated fats, also known as some bad fats, are solid at room temperature. They're okay in very small amounts, so like less than 10% of your daily calorie needs. Excess amounts can lead to heart disease. The sources of those include animal fats like lard and tallow, cocoa butter, chocolate, coconut milk, dairy like butter, cream, and whole milk, palm oil, and red meat. Your trans fats, which are terrible for you, those are solid at room temperature. They're found to raise your bad cholesterol and lower your good cholesterol. They're largely found in your processed vegetable oils, and there's also trace amounts in certain red meats and dairy products. So be careful. You have to learn how to read labels. So let's talk about like daily needs of what you need in your body every day. So a recommended daily intake of your calories is 40 to 50% in carbs, 20 to 35% in protein, and 20% fat. The first step is, are you at a healthy weight? Do you want to do those recommended daily values? Or is your goal to lose or gain weight? That's going to depend on what you want to do. It will depend on what you intake. A BMI is known as a body mass index. That's where we compare your height to your weight, and that's what your BMI is. A normal BMI, 25 to 30 calories per 1 pound of body weight. For a BMI of less than 30, you want to do 11 to 14 calories per 1 pound of your body weight. And for a BMI above 50, you want to do 22 to 25 calories per 1 pound of your ideal body weight. So a BMI for ages 20 to 64, the healthy one is 18.5 to 24.9. If you don't know your BMI, you can always discuss this with your provider, and they can help you with that. For older people for 65 or older, a healthy BMI is 23 to 29.9. Preventative nutrition. So metabolic syndrome is where our body starts having biochemical and physiological abnormalities that are associated with development of cardiovascular disease and type 2 diabetes. So cardiovascular disease is high blood pressure, artery disease, increase in your bad cholesterol, any type of cholesterol, and then your triglycerides as well. So those are your different cardiovascular disease. And then type 2 diabetes. Metabolic markers that we use to assess your overall health includes a fasting blood glucose, which we talked about in the previous presentation we did, a blood pressure reading, triglyceride and cholesterol levels, HDL cholesterol, and then your waist circumference. Preventative nutrition. So two of the best research, I think I skipped a slide, hold on, sorry. Maybe? I don't know. Sorry. There it went. Oh no, I didn't skip the slide. Two of the best research diets that are recommended for people are your Mediterranean and your DASH diets. And I know Miss Monique just handed out some stuff about those two diets. So both of those diets support heart health, high blood pressure health, blood glucose control. Both diets emphasize whole foods, healthy fats, high fiber, and limiting added sugars, highly processed foods, and excessive salt and red meat intake. So if you didn't get a handout, just let us know, we can get you one. My thing's not working. Thank you. Okay, on to kidney function, and then I have some help today. So, kidney education. This is becoming big in the United States. It has been for a while, but we're trying to start educating more and more because kidney disease is a silent disease. And we'll talk about that a little bit more. But about 1 in 7 adults in the United States have kidney disease, and about 90% have no idea that they have it because there's not a lot of you don't have a lot of upfront signs that you have kidney disease. There are 5 different stages of kidney disease, and the stage depends on lab values and your symptoms. Kidney disease is now a major public health concern because there's no notable symptoms in early kidney disease. So it goes undetected until the advanced stages, which unfortunately is when someone either requires dialysis or a kidney transplant. The key is to find kidney disease before the trouble starts. So speak with your primary care provider about specific testing to check your kidney function. Regular testing for everyone is important, but it is especially important for people that are at risk. What do your kidneys do? They remove waste products and extra water from your body. They help maintain your blood pressure. They keep your bones healthy. They help make red blood cells, and they balance important minerals in your body as well. 7 problems kidney disease can cause. Kidney failure, which is the end-stage kidney disease, which requires dialysis or a kidney transplant. Heart disease, which is, it can cause heart attacks. It can cause your arteries to clog. High blood pressure, mineral and bone disorders, high potassium levels in your blood, which can be dangerous or fatal, and low levels of red blood cells. Certain disorders can either be a cause or a result of kidney disease. So kidneys can cause high blood pressure, or high blood pressure can cause kidney problems. Heart disease can either be caused by kidney issues or it can cause kidney issues. Heart disease, same thing. It can either cause kidney disease or the kidney disease can cause heart disease. It can cause stroke, or stroke can cause kidney disease, and then diabetes can also lead to kidney disease as well, and kidney disease can lead to diabetes. So assessing your risk of kidney disease. Do you or your family member have diabetes? Do you or a family member have high blood pressure? Do you or your family member have heart disease or heart failure? Do you have a family history of chronic kidney disease or kidney failure? Do you have a personal history of an acute kidney injury? And are you overweight? Other risk factors include being 60 or older, a prolonged overuse of your non-steroidal anti-inflammatories, which is your ibuprofen, naproxen, Advil, things like that. Do you have lupus? Have you had chronic urinary tract infections? And have you ever had kidney stones? Recognize the symptoms of kidney disease. Can include fatigue and weakness, difficult, painful urination, foamy urination, pink, dark urine, like blood in your urine, increased thirst, an increased need to urinate, especially at night, puffy eyes, swollen face, hands, abdomen, ankles, feet. Having nausea or trouble concentrating. Okay, healthy tips that everyone should do to keep from getting kidney disease, or if you've already been diagnosed with kidney disease, to keep it from advancing. Exercise regularly. Control your weight. Follow a balanced diet. Quit smoking. Drink only in moderation or not at all. Stay hydrated. Monitor your cholesterol levels. Get an annual physical, and know your family medical history. 5 things to do if you have kidney disease. Lower your blood pressure if it's not where it needs to be. Manage your blood sugar levels. Reduce your salt intake. Avoid those NSAIDs that we talked about before, like your ibuprofen, naproxen, Advil. Moderate protein consumption. So like we talked about before, there's 5 stages of kidney disease. So with protein intake, if you have kidney disease stage 1 through 3, you want to take about 0.8 grams of protein per kilogram of your body weight in. For stages 4 and 5, you want to take about 0.6 to 0.8. because your kidneys are what break down your protein. So you have to be careful. Adequate water and fluid intake is important as well. So general recommendations for our daily fluid intake is about 13 cups for men and 9 for women. 1 cup is 8 ounces. Physical activity may require more, and some diseases may require less, like depending on what kidney disease stage you're in, they might want you to drink less fluid. Also, if you have heart failure, and then usually 65 and older require less fluid consumption as well. I'm gonna stop right there and let you add on.
Is it okay if I see it? Hello, everyone. Again, I'm Yolanda. I am a nephrology nurse practitioner and have worked in the field of nephrology for more than 25 years. And so in my role at University Health, I manage the care of patients who have chronic kidney disease and those who have end-stage renal disease, and of course, those who have been transplanted as well. And so this is a topic that is very near and dear to my heart. And so I really thank you, Cindy, for getting me involved here. And I say that because in my role, in terms of our patients who have end-stage renal disease, I go to 7 different clinics around the community here. And when I walk into those clinics, the people that I see, at least 98% of the people that I see look like me. And so it is very important for me to really get the word out about chronic kidney disease, what those risk factors look like, and also what can be done to delay progression. And so there will be a little bit of overlap, but I do want to just reiterate that normal kidneys, as Jennifer said, is responsible for removing water and waste. And when our kidneys aren't doing their job, waste products and water stays in the body, okay? And so, one of the ways that a person can determine if they have kidney disease, I always tell people to pay attention to your lab. I have a family member who is under the care of a primary care doctor and had me to take a look at his lab. And he said, you know, the doctor told him that everything looks great. And then for me, my eye went to what we call the estimated glomerular filtration rate, which gives me an idea of how much kidney function he has. And so I determined that he was in stage 2 of chronic kidney disease. And I also had him to give me a trend so that I could determine if it was acute kidney injury or if it's truly chronic kidney disease. And we went back at least 2 years, and he's had CKD for some time now, and his doctor didn't tell him. So yes, 1 in 3 adults in America have chronic kidney disease. And there's 37 million people in the United States that do have it. And like Jennifer mentioned, 90% of those, they don't even know that the condition exists. And the biggest thing related to that is that, I don't want to bash on primary care, but I know that, you know, when you see your primary care doctor, usually those visits are maybe 15 or 20 minutes, and the doc addresses, you know, what you came in for. And many times, a person's kidney function is overlooked. And so that's the biggest thing. And so there's 2 leading causes of chronic kidney disease. One is diabetes, second to that is hypertension. And if you have any of those, make sure your primary care doctor checks you on an annual basis to determine if you potentially have chronic kidney disease. I'll also add that race plays a role too. And so just those things, please keep in mind. As Jennifer mentioned, there's 5 stages of chronic kidney disease. There's 1, 2, 3A and 3B. There's 4. And then there's stage 5, which is considered kidney failure or end-stage renal disease. And so any of our patients who their function is less than 15%, they're either on dialysis or actually preparing for it. And so kidney failure is the point at which a person needs to have dialysis to live. Also, what we do for end-stage renal disease is kidney transplant. And really it is our goal to have patients transplanted before the need for dialysis. However, depending upon the type of disease that they may have, could result in them being placed on dialysis sooner than getting a transplant. Also, there's individuals who have end-stage renal disease who make the decision not to do dialysis. And so when we know that, education, is hugely important. I believe that knowledge is power. And so if our patients determine that this is not the course that I want to go, we call that conservative management. And so if this is the case, truly, what we're doing at that time is managing the complications that come along with end-stage renal disease and even kidney disease, which is anemia, issues with your electrolytes, hyperphosphatemia. It goes on and on, but we do respect the decision that our individuals make, our patients make regarding that. If you have diabetes, if you have hypertension, if you have a family member who has kidney disease or a family member who has been transplanted, you are at risk. And so there's 2 tests that if you have those risk factors to talk to your doctor about, and that is a blood test that will give us an idea of what your creatinine is, which is just a waste product. It'll give us an idea of what stage a person's kidney disease is in. And then there is a urinalysis, which checks to determine if you have protein in your urine. And Jennifer mentioned that, as I saw on the screen, some of the symptoms or things that a person may see if they have kidney disease is foamy urine. And essentially, that's just protein that is being spilled. We all urinate out protein, but when it comes abundant, we know that there's damage to the kidney. I do also want to add that African Americans are disproportionately impacted. And so I mentioned that the majority of patients that I see are African American, but there are Hispanics who are impacted as well, Asians as well as Pacific Islanders. But in terms of the individuals who are impacted the most is African Americans. We talked about the causes, we talked about the stages, we talked about getting tested. If a person decides to, if they have end-stage renal disease and they decide that they, want to start dialysis, there's hemodialysis, and that's when a person goes into the dialysis center. You walk in, you get your treatment. The work is done for the patient. And then, of course, there's those who decide to choose a home modality, and there's peritoneal dialysis, which is a more gentle way of doing dialysis, in your home. And then there's home hemo. So the type of dialysis that we do in the dialysis centers, patients can learn how to do those at home as well. I think the biggest things that I want to convey today is that if you're at risk, have your primary care doctor order those 2 tests. And I have some information here on that. Your blood test and a urine test. It's very simple. And at least have it done on an annual basis. The other thing that Jennifer mentioned, when I am doing education with my patients, I always talk about things that we can do to delay progression. So if we know that the leading causes of kidney disease is diabetes and hypertension, it's hugely important to assure that your blood sugars are under good control. We'd like for them to be, your hemoglobin A1C, if you're familiar with that, to be less than 7. And if a person has hypertension, it's hugely important to have at least normal range pressure. So if you have chronic kidney disease, if you have diabetes, the goal for your blood pressure, top number 130, less than 130, the bottom number less than 80. So again, just going back, blood pressure control, blood sugar control. Jennifer talked about, exercising. If you need to lose weight, please do so. If you smoke, stop. If you drink alcohol, in moderation. I'm just trying to think if I'm leaving anything out. I do also want to tell you, if there's individuals who actually have a diagnosis of chronic kidney disease, it's hugely important for everyone to know, yes, you have chronic kidney disease. I've seen in practice medications that are prescribed to our patients and they're not renally dosed. So if one of our patients that is on dialysis and they go to the ER, they're diagnosed with, say, a urinary tract infection, and the emergency department doctor gives that person Bactrim double strength, twice a day, that is too big of a dose for a person with kidney disease. And as we know, with kidney disease, waste products build up, and that would be an example of that. So many times I am changing medications. Yes, please avoid Advil, ibuprofen, Motrin, meloxicam, naproxen, because if you have chronic kidney disease, they will worsen your function. I think those are the biggest things, and I'm going to hand it back over to Jennifer.
We can go back to the presentation. Now we're going to talk about healthy sleep, which I know some people struggle a lot with healthy sleep. So let's talk about healthy sleep. So recommended daily hours of sleep is 7 to 9. Quality sleep, quality sleep. Tips to better sleep. Stick to a sleep routine. So I know we all love sleeping in on the weekend if we have a Monday through Friday gig. Not really that healthy for you, unless it's about an hour, give or take, off of your time frame. Otherwise, you need to get up at the same time every day, including the weekends. That includes my teenagers in here. They like sleeping in on the weekends as well. Sorry, I was doing a shout out to my nephew. Being consistent reinforces your body's sleep-wake cycle. If you're unable to fall asleep within 20 minutes of laying down in your bed, get up, leave your bedroom, and do something relaxing. I just learned about this not too long ago. Didn't even know this was a tip. Read or listen to some music when you get up out of your bed and leave your bedroom. If you can't go to sleep within that 20 minutes, read, pray, do something soothing. Don't go do jumping jacks and things like that. That's not gonna work. So pay attention to what you eat and drink. Do not go to bed hungry, but don't go to bed stuffed. So avoid heavy or large meals within a couple of hours of bedtime. Nicotine and caffeine will make it hard to fall asleep. Caffeine and nicotine have stimulating effects in your body, so they can take hours to wear off, and they also interfere with your actual sleep cycle. Alcohol might make you feel sleepy at first, but it's going to disrupt your sleep in the middle of the night. Create a restful environment. Keep your room cool, dark, and quiet. Exposure to light in the evenings can make it challenging to fall asleep. Avoid prolonged use of light-emitting screens 1 to 2 hours before bedtime. So, TV, your phone, tablet, iPad, I don't care what electronic device it is, you need to shut it down 1 to 2 hours. So if you're gonna go to bed at 9 o'clock, you need to shut the electronics down at 7, because your brain is gonna continue to function on that level if you do not shut the electronics down. That includes the television in your bedroom. Engage in calming activities before bedtime, like taking a bath or using relaxation techniques. Limit your daytime naps. So long daytime naps can interfere with your nighttime sleep. So limit to about an hour, and then don't sleep in later evening. Include physical activity in your daily routine. So doing regular physical activity can promote better sleep, but don't do activity too close to bedtime. So same time cutoff, like 2 hours, 3 hours before bedtime. Spending time outside every day is also helpful. Managing your worries. So try to resolve your worries or concerns before bedtime. So journal and set it aside for tomorrow. I know sometimes that's hard, we think about things, but it does distract your sleep. It interferes with your sleep cycle. Stress management is very helpful. So just start with some basic organization things, setting priorities and delegating tasks. Also meditation and prayer is also helpful. Listening to some good meditation music or whatever you want to do. when to contact your primary care provider. So obviously, almost everyone has an occasional sleepless night. However, if you continue to have trouble sleeping, you need to contact your healthcare provider because you can identify and treat the causes so that you can get the adequate sleep you deserve. Our body has to have rest to be able to do the things that it needs to do. That doesn't mean just us physically, but that means the cells in our body, our organs, like it depends on us getting adequate sleep. So educate yourself because you are your best advocate. I'm gonna tell you guys a few stories and then we'll take questions. So my father was recently in the hospital. I would say he's 75, and yes, I got permission to share his medical information today. He has not been eating properly, but he got sick all of a sudden. I told my mom to take him to the emergency room, and we found out his sodium level was extremely low, and he just wasn't overall feeling good. Well, me being, his daughter and me being a nurse practitioner, my father also is an alcoholic, and he drinks his beer every day. And so over the years, pretty much, he's done a really good job of like maintaining good health besides, him drinking his alcohol. And I've talked to him about, his kidneys, his liver, his adequate fluid intake, but he kind of crashed. And so he has not done the greatest job of educating himself about his own health. And so I knew right off the bat, unfortunately, that, some healthcare providers are judgmental. And I knew once we told them that my dad drank, that was gonna be the source of what they were gonna say was going on with him. And so as the labs came back and as my dad wasn't getting any better, I had to start advocating for him because I didn't feel like the proper tests were being run. They wanted to blame everything on the alcohol intake and the poor nutrition. And so why am I saying all this to you? Because it is very, very important for you to educate yourself. Pastor talks to us about all the time about educating ourselves. And when we don't educate ourselves about things and we talk about things we don't know about or just not know, it's ignorance. And so I'm here standing in front of you. We're providing you guys with education, but I need you guys to learn about your own health yourself because you are your best advocate. And as well, I'm sure you have a loved one that you have in your life that can be advocates for you. We do our best as healthcare providers, most of us do. But like she said, we do have certain people that don't know about things, and so that's when it becomes your responsibility. If something's going on with you and you don't feel like you're being heard, ask for a specialist. Educate yourself. There are plenty of reputable websites that will educate you on what could be going on with you, on what you might think is going on with you. And then if you need help, you come to church. I don't ever care if you pull me to the side and ask me questions. Or I'm sure none of us care if you pull us to the side and ask us questions. But please advocate for yourself. But don't go to your doctor or your provider and say, Miss Jennifer at church or Dr. Google. Do not use Dr. Google for your education material. There are reputable websites for you guys to learn about your health. And that's, you have the Kidney Foundation, you have your Heart Disease Foundation, you have, there's so many websites and even colleges, universities that provide reputable material for you guys to educate yourself and be your own advocate. Thank you for listening, and this is part of you guys advocating for your own health, and now we will take questions. Oh, you guys have to come up to the podium and ask questions, by the way.
Good morning. Thank you for your information. When you were talking about how you get a copy of your lab reports, what area was that you said you should pay attention to? I didn't quite get that word, and how do you spell it?
For your kidney disease?
So I would say the first word is creatinine. And essentially creatinine is a waste product, right? And so when we eat food, our body breaks food down into a waste product. The nutrients that our body needs, it uses, and what it doesn't, it sends to the kidneys. And so that's where kind of the cleaning goes on. And then we urinate out the waste. The creatinine, normal for women, is 1 or less. And for men, 1.3 or less. So number one, we look at creatinine.
When you get that report, it has a lot of abbreviations.
CR.
CR.
Capital C, lowercase r.
Okay.
And I really hope that the word is there, creatinine, because that could be mistaken with another test. But we need the creatinine, and then you should look at the EGFR.
I'm sorry, E what?
EGFR.
F is in Frank?
F is in Frank, R is in Robert. And so this gives us an idea of what your function is. So there's a calculation that takes into account your age, your sex, and then your creatinine. And on your labs, it will say GFR. And so really that's the main thing you want to see to determine what your function is. 90, for example, is considered normal, but if you have protein in your urine, it's kidney disease. So it is important to look at your EGFR and the amount of protein that you have in your urine. But you look for those things, and then if you have questions, definitely ask your doctor about those, just to kind of reiterate it. But we need those things to determine kidney function.
Thank you.
Yes, ma'am.
Hi, I had a question. When you were talking about kidney disease affecting African Americans, is it based off genetics, or is it like barriers in the African American community?
That is a really very good question. So our kidney function declines as we get older. So even if you look at your own test results, you may see that you have chronic kidney disease because our kidney function declines, again, as we get older. What was the other part of your question?
If it was a genetic
Families.
disposition.
Yes, so we do know that being African American is a risk factor, but I have been working in nephrology for so long that I'm starting to see families. So I actually used to practice at Kidney Associates of Kansas City, which is on 65th and Truce. And then, of course, there's a dialysis center next to that. And so I remember managing the care of a lady, and she subsequently got a transplant. And so last year, a patient was referred to me, new consult, because her kidney function had declined. And I really do try to get a thorough history from the patient, social history, family history. And she told me that her mom was on dialysis, but her mom was transplanted. And I asked her to tell me her name because I'm affiliated with most clinics, and come to find out, the lady that I just mentioned was her mom. And so when we start to see families, it is a concern because there is a genetic component to it, which is called the APOL1 gene, and it tells us if other family members, or if a person has this gene, then their family members are going to carry it as well, and those individuals are at risk too. So there is genetic testing, but that's a really good question because I'm seeing it, and certainly it does happen.
Thank you.
I have horrible sleeping habits because of the way I work. I did see something on the screen that talked about drinking alcohol, that sometimes it makes you sleepy when you first go to sleep, but then you wake up in the middle of the night. I have experienced that a couple times. I don't drink a lot, but when I do, I have experienced that. But there are days that I'll get 7 or 8 hours sleep in 2 nights combined, because of the way I work. But any other tips? I don't get a chance to take naps every now and then. I wake up the same time every day, 5:30, 6 o'clock in the morning. I'm kind of just all over the place. So I guess my question is, the handouts that you gave, is that more information about sleep habits as well? Will that lead to kidney disease as well? Bad sleeping habits?
So in terms of kidney disease and sleep, I would say no. One of the things that I did fail to mention is that the symptoms of kidney disease, they don't really crop up until a person's in those later stages, so stage 4, stage 5, and that's when we'll start to hear about metallic taste in the mouth, swelling in the hands, feet, and face, metallic taste, nausea, vomiting, reduced appetite. There can be some fatigue. It could be in some insomnia, but it's not a contributor to CKD.
As far as the handouts, no, there's no information about healthy sleep habits. However, so what time do you normally get off work?
From the post office, generally 4:30 or 5, but then I may jump in a limousine 2 in the morning.
Okay. So it's hard for you to get on a good schedule.
Exactly.
Okay. My advice to you is to do your best to get on a good schedule, because your body does need 7 to 8 hours of sleep every day. And even if, you have to split it up, really, you shouldn't be splitting it up, but get some sleep, and then when you get back home, get some more sleep. But our body is really run off of a natural cycle. So it really wants us to be on the same schedule every day. Is your room darkened? Because sometimes too much light in our room can not improve quality sleep.
Now, I'm a news hound. The last thing I do before I go to sleep is turn on the news for.
Yep, don't do that. No.
So I'm doing
no
everything wrong.
electronics 2 hours before you go to sleep. They say 1 to 2 hours. I say 2, because your brain will not shut down.
Okay.
So, yeah.
Okay.
Kind of add something to that. So I know that people who maybe work overnight, their sleep schedule is challenging. And so if you try to carry out some of the tips that were just mentioned and you're still having a problem, I would recommend you speaking with your primary care provider. You may potentially need a sleep study. It could be something that's being missed. So definitely communicate that to your doctor.
Thank you. I actually got 6 hours sleep last night.
Good.
On the screen, it was talking about how kidneys get rid of excess water. How much water should we drink? Those of us who are 65 and older.
So about 64 ounces of water is good for someone 65 or older. About.
So how much?
64 ounces or more. Really, 64 ounces should be good enough. My dad does not have kidney disease, but sometimes he drinks too much fluid and it lowers his sodium intake. So I would, first of all, have you ever been checked for kidney disease? Have you been checked for kidney disease?
My doctor checks my urine and she will let me know.
Okay.
My kidneys are fine.
Okay, good. So then with that being said, then yeah, about 64 ounces, 60 to 64 ounces of fluid intake.
A day?
Yep.
Okay.
Yeah.
Thank you.
And I'll add on a little piece to that. So if a person has been diagnosed with congestive heart failure, there is a limitation on how much you should drink. But for the patients, many of the patients that I see, I tell them to drink to thirst. But one of the ways that you can tell that you're not drinking enough is if you go and urinate and the urine is gold, you're not drinking enough. It should be clear. It should be clear, like lemonade.
I most definitely want to just say thank you for doing what you're doing and sharing the information. Mike is known by all of us men that he don't slow down for nothing, but he needs to. So, thank you for this. You mentioned the percentage of folks that don't know that they may be suffering. What was that percentage again?
90%.
They don't know they have it.
They do not know that they have it.
And I guess for the congregation, the audience, can you repeat or give out a flyer on what are the symptoms that we just are overlooking? If 90% of us don't know it, what are some telltale signs that, you can help us out with?
I'll let you.
Again, early on, there's no symptoms. I've been doing this for so long. And when I started working in nephrology at a dialysis center, the majority of our patients were seniors. And so now what I'm seeing is that they're coming in younger, 20s, 30s, very different. And so, I don't know, let's see. They're younger, and so, again, the symptoms a person may have, they won't have them until late stages. So early on, you may have some fatigue, you may have some shortness of breath, you may have some nausea, but it won't really track to CKD. And so that's why I say that if you are at risk, if you have hypertension, if you have diabetes, if you're African American, if you have a family member who has kidney disease, just talk to your primary care doctor and ask them to collect those two tests, the urine test and the blood test. And please always get a copy of your lab so that you can, and you may not really understand because they do have a reference point, but when you have kidney disease, it's a little different. But always ask for a copy of your labs and always have your provider to explain what is seen on paper and the impact and what you can do to delay progression.
And like we talked about before, educate your own self so you know.
Oh, good afternoon. We mentioned about, is there any natural holistic remedies for kidneys? There's a lot of herbs out there, for inflammation, for inflammation, okay. Is there any natural remedies for resolving a kidney issue? Like teas that they have out there right now, natural things instead of, you didn't mention any in medication or anything like that, but there are some natural holistic remedies out there that we can use besides the medication that they have out there.
So unfortunately, once you're diagnosed with kidney disease, you have it. The plan from a provider nephrologist standpoint is to not progress it. And so your natural ways are controlling your blood sugar, controlling your blood pressure, exercising, adequate fluid intake, those types of things, adequate nutrition. So as far as like herbal remedies, once you have CKD, there's no cure for it, so to speak. The plan is to not progress it. But I'm gonna let her talk a little bit.
I'm not sure if it's a progressing thing, but I'm gonna put this out here. They tell me that dandelion tea is good for your kidneys.
Who?
So,
Who said that?
and I've had testimonies, I have a testimony on that too, so I'm just gonna put it out.
Thank you. One of the things that I will add is if a patient is referred to nephrology and we're trying to determine the etiology of the cause of their disease, and say they don't have hypertension, let's say they don't have diabetes, but then when we go through over the counter, when we look at over the counter medications, we ask that question. We also ask about Chinese remedies because those things, if a person has kidney disease, can potentially worsen it. And even there's men who are bodybuilders, they're in the gym and they take creatinine and take in a ton of protein. You have to be kind of cautious with that, and again, communicate to your provider if you're taking something. And even before you purchase it, ask your doctor if it's safe for your kidneys. And then I'm so sorry, I haven't heard anything about dandelion. So if you have information that I could read, that would be wonderful. But essentially, the decisions that we make in terms of guiding practice or plans of care is based upon literature that has been shown to be proven to, reduce function. And I'll also add, there's some great medications out now. You guys may see commercials if you have CKD, Jardians, or what have you. So there's lots of great medications that we can use that will delay progression.
Yes, I would like to know if you've had a pre-existing condition, let's say cancer, does that increase your susceptibility to kidney disease?
I would say yes, because medications that chemotherapy, radiation can certainly have an impact on the kidneys. We definitely, when a person is on chemo, we watch the kidney function closer just because we know that it can worsen to some degree. And then, of course, that's when we have to discuss, the risk versus the benefit. Okay.
I just had a question about advocating for yourself. Because I had lost my voice and I kept losing it around the same time of the year. I'd lose it for months, and so I was telling my primary care doctor that the sinus medicine she put me on was not working. I wanted to see another doctor, a specialist, to see about it. And when I went to the specialist, who was telling me later when I found out that I had something else, I had acid reflux going on. And he told me she had put in my file that I was a problem patient and that they had had a discussion in our meeting regarding me, and he just decided to go ahead and take me and go ahead and do the test because they were having a hard time getting me assigned to someone because that was in my file. So what do you do when that's in your file, and how do you fight against that?
That's difficult. You can go to the provider that you found out did it and ask them to stricken it from your record. You can also go to medical records and, talk to the person in that actual medical record, like that works for that hospital or that group, and talk to them about, why that was done. That's my best advice for that. I'm so sorry that happened to you. We do our best to not put things like that, or I don't know why that wordage was used, but there are other ways of putting pleasant other information. But yeah, you can ask that to be stricken from your record.
They need to define what problem means. Because they put it in your chart and, I didn't mean it that way or whatever. Get them to, I noticed this was in my chart. Can you explain to me why? Because a lot of times, some people ask a lot of questions and that person gets labeled, oh, wow, you don't really want to, and things like that, when all you're doing is just trying to get a better explanation for it. Some patients can be challenging. All three of us can tell you that in the health field, but I think those same individuals, sometimes you can see them out in the community too. And it's not really, I think it's just a challenge because of lack of knowledge as opposed to challenge because they just want to challenge you. Now, we do have those people, but most of the time it's the people we take care of in healthcare.
My question is a water pill, is that damaging to the kidneys?
Sometimes, I mean.
When I mentioned work, the risk versus the benefit, so the thing is that people are on diuretics or water pills for various reasons. It could be to help control blood pressure. It could be for heart failure. But when a person is on a medication like that, we can see a little bit of a decline in the kidney function. But if a person is having swelling in their lower extremities, we gotta weigh the risk versus the benefit. So the benefit is that we're getting fluid off of you so that you won't end up in heart failure. So with that said, we just need to look at labs closely to make sure you're not getting too dry. And if you are, maybe putting you on a lower dose, but we wouldn't stop it altogether.
Thank you.
Just wanted to take the opportunity to thank Ms. Cynthia, Ms. Jennifer, Ms. Yolanda for presenting on the health ministry today. I want to thank each and every one of you for coming out and participating. I'm going to turn it over to Browna. She's going to close us out with a prayer, but it's also a scripture as well.
Okay, this is number 6, 24 through 26. The Lord bless you and keep you. The Lord make his face to shine on you and be gracious to you. The Lord turn his face towards you and give you peace. Amen.
Enjoy the rest of your Palm Sunday, and we'll see you again next week. God bless you. Much love. Thank you, AV team.
Okay. And good to see you as well. Thank you.